Hello and welcome to Connect and Collaborate. I am Alex Hopkins, your on-air producer. And today's show, we are talking with Clare Krusing. She is the spokeswoman for Stop the HIT Coalition, and that is HIT as in health insurance tax. And it's a big issue that we have going on. And so we were able to stop the tax for 2018, but the new 2020 year for the health insurance tax is coming back. So we are speaking with the spokeswoman from Stop the HIT Coalition to get more information on why that's pertinent to you as a small business owner, pertinent to you as an individual, pertinent to you as your family is concerned for health insurance. So welcome, Clare. I appreciate you being here with me today. So I always like to give a little bit of background on my guests for our audience. So again, Clare Krusing, spokeswoman for Stop the HIT Coalition. How are you doing today?
I'm doing well. Thanks so much for having me on.
Yes, thank you for joining us. Clare, I'm going to have you give us your background and how you wound up as being a spokeswoman for Stop the HIT.
Well, it is a very long and windy and unexpected path. I graduated from Indiana University with a degree in journalism and got the Washington, D.C. bug a bit. Was always very interested in politics and policy. And, of course, if anyone in your audience was watching The West Wing at age 11 like I was, you kind of grew up with a strong urge to try things in Washington. And I moved out here after college and really started to get in depth with a lot of the policy issues facing small businesses, in part because I've always grown up in small towns where small businesses are really the lifeblood of our community, of our neighborhoods, and make a tremendous difference in just how we engage with our neighbors. And so Stop the HIT Coalition is really a byproduct of that movement and focuses specifically on the health insurance tax that has a harmful impact on the coverage that small businesses offers to their employees around health insurance. So our goal and our mission is to repeal and essentially stop the HIT and make sure that the folks who serve our communities and our neighborhoods every single day have access to affordable health insurance, and that this tax that drives up their premiums goes away for good.
Right. And this came about with the Affordable Care Act, correct?
Correct. So it was included as one of several taxes in the ACA, and really is a contradiction to the goals of health reform. So the goal of the ACA was to make coverage more affordable for Americans, including small business owners and their employees, and yet adding a sales tax on health insurance directly increases the cost of premiums that folks have to pay.
I gotcha. So let's foray here a little bit into the background on the Stop the HIT Coalition. Obviously, a lot of like-minded people wanted to come together on this and stop this health insurance tax. And the motivation seems pretty apparent, right? We want to make sure that we're keeping healthcare affordable, yet this, as you said, was a contradiction to the goal of ACA.
Correct. So one of the benefits of the Stop the HIT Coalition is that it does bring together a wide-ranging group of employers and small business organizations that represent industries across the country. And we've been incredibly successful in educating and engaging policymakers around the impact of the health insurance tax on coverage, and that includes hosting roundtables and doing events in states like Colorado, where local businesses have a chance to meet with their representatives and talk to them specifically about what it's been like to receive their health insurance bills and see these costs go up. year after year. And I do believe because of the direct engagement from our coalition members, which again include the small businesses across the country who have been actively involved in these policy debates, because they've been willing to engage and talk to their members specifically about what we can do to make coverage more affordable and why the health insurance tax doesn't make sense as part of that equation. We've been incredibly successful about suspending it over the past several years, and you were correct. The HIT has been suspended multiple times, not necessarily in 2018, but in 2019, and we're looking to suspend it again when it returns in 2020.
Exactly. So let's talk about the history of health insurance tax itself. So we mentioned that, again, this is as a part of the ACA, the Affordable Care Act, and very much a contradiction to that. I'm going to continue to use that because I love that you said it that way. But that being said, why incur this in the first place if the goal of ACA was to make healthcare more affordable for citizens, small business owners, seniors in particular? Why was this necessary to increase this tax particularly?
Sure, that's a great question. I think one of the initial considerations when the ACA was first being debated is how do you fund some of the core components of the law, like the subsidies for individuals who are under a certain financial status, or the certain exchanges and other key essential components of the law. And while that financing question was always an important one, the unfortunate reality is that the law included the health insurance tax and other taxes that ultimately increase the cost of coverage, which was not the intent and not the goal of the ACA. So from the start, this was really one of the policies and provisions of the law that stood out as directly contradictory, and we can keep using that word too, directly contradictory to the spirit and the goal of the Affordable Care Act. And that's why we've seen many Republicans, Democrats, members from both sides of the political party engaged on repealing, suspending, and ultimately doing away with this tax. Because of the recognition that it really undermines the goal of affordability across the board.
Wonderfully said. I want to hone in on exactly why this is important to every individual. As we mentioned, small business owners are taking a big hit. Seniors are going to take a big hit. A lot of Medicare, Medicaid beneficiaries are going to take a big hit. But if I work for a large corporation and I'm already paying my insurance through them and they aren't taking that big of a hit, why is this important to me? Why should I jump on board with the Stop the Hit Coalition and sign the petition?
So one of the major challenges with the health insurance tax is that it never goes away. So it increases year after year. And for example, in 2020, small businesses that offer coverage to families, those families will see an increase of more than $400 on their premiums for folks that are in Colorado. That's a huge and steep increase, and I'm sure everyone listening to this show probably has 10 things that they could spend $400 on that were probably equally as beneficial and important to their family. And the fact is that we can suspend this tax and deliver that cost savings directly to families that are in need of it. And so that's why we have been very, very strong, very, very vocal on making sure that this tax does go away, because it's important that small businesses that are looking to grow their companies, that are looking to offer competitive benefits and offer more jobs, are not burdened by a tax that ultimately makes it harder for them to do all of those important things for our communities and for their businesses. And this tax really does undermine the work that they can do So as we look at policies and everybody talks about how do we lower the cost of health care, repealing the health insurance tax is the best way to do that.
Awesome. I appreciate that. And I just want to give our audience here a few facts. And we will definitely hook up the Stop the Hit website so that people can get more information. But specific to Colorado, there's some big numbers here. As you mentioned, family coverage is going to go up by $400. Specifically, that's $422 in Colorado, $434 for large employers, $422 for small employers and their employees. Again, seniors and disabled individuals are going to see an increase of about $448 per couple. Consumers in the individual market will see about an increase in $170. And Health First Colorado, which is one of our Medicare, Medicaid entities that we have, will see an increase of about $5 million. Those are big hits, and again, where you're stating money that could be used in many other aspects. That $5 million could easily go towards helping other people with their cutting down medication costs, right? Prescription costs, things like that.
Exactly, and there are tons of opportunities for this level of cost savings to have a mutual benefit, not just to the public programs that we talked about, but again, to families that are looking to save on healthcare, looking to make investments in their kids' education and other critical areas where that money can make a big difference. And so we all know that healthcare costs continue to go up, and that families do depend on their health insurance. Making it more expensive doesn't make sense for them.
Absolutely. And, this is one of those things we've talked a lot about in this country, and I know that we've seen it in every election. We saw it in the 2016 election. We saw it again in local elections in 2018 across the country. Healthcare is a big focus, not only nationally, but for states, right? That's something that we're all trying to get on the same page for. And over again, we see that citizens want to lower healthcare costs. And the biggest way to do this, as you're advocating for, is to take away this health insurance tax. That being said, just a question for you, Claire, on if we got rid of this health insurance tax and we kept the Affordable Care Act, could that still survive, or would we have to go a completely different route with health care in general?
No, that's a great clarifying question. So sometimes folks confuse the health insurance tax with the individual mandate penalty. And they are two entirely separate things. The health insurance tax is purely a sales tax on health insurance. It directly impacts the dollar amount that a consumer has to pay for their insurance. So in Colorado, the amount that individuals pay for their coverage is based on a variety of factors, including the average cost of providing care in certain markets and partnering with certain hospital and provider groups, and ultimately, too, the cost of healthcare in general. So the cost of prescription drugs, the cost of surgeries, medical devices, the whole 9 yards. The sales tax and the health insurance tax gets added to all of that. So simply eliminating it and suspending it would still preserve the core components of the health reform law. So the pre-existing conditions provisions would still be there. The exchanges would still be there. The central tenets of the law would still be there, but one of the more egregious sort of cost drivers would be eliminated and provide that, again, more affordable coverage to the people that really need it.
Awesome, because it's more of my personal opinion. I would say that the Affordable Care Act wasn't a bad act to go through, and it's helped a lot of people along the way. But this health insurance tax in particular is its own entity of the Affordable Care Act that we could do away with and still have great coverage for families all over the states.
Correct.
Awesome. So I guess I want to ask you, Claire, a little bit, if we were to get rid of ACA altogether, do you think there would be a similar implementation of the HIT in a different health insurance package?
You know, it's hard to say, and I don't think that there's a clear sense yet of what are the next steps. There was a court case on Friday that I'm sure folks may have seen that a judge did rule against some of the central provisions of the law. But I think moving forward, whatever changes come of the ACA, or if there's a discussion about a new sort of reform package, I think folks need to be mindful of taxes that would increase the cost of coverage and would make it harder for people to afford their insurance. So it's probably too early at this point to say whether another tax like this would be included in any type of proposal moving forward, but we would hope that policymakers understood the harm and the consequences of doing so and would not include a tax like that in the future.
Well, I hope so for sure. And again, even if we keep the ACA, we still want to be able to get rid of the HIT. The HIT is a multi-billion-dollar tax imposed on a health insurance premiums for poor and middle-class workers, seniors, small businesses, and Medicare and Medicaid beneficiaries. The HIT has made healthcare less affordable for those most in need of relief. I did find that little summary there on your website. Again, not again, but to begin with, that is stopthehit.com if you want more information. But I want to underline here that it's made healthcare less affordable for those most in need. Do you mind honing in a little bit for me on that and exactly
Sure.
what you mean? Yeah.
Sure. So in the case of the HIT's impact on small businesses, most individuals and those that are paying the vast majority of the tax are actually small business employees. And in many cases, they're paying increased premiums year after year at a higher rate than anyone else. So when you think about the amount of investment that small businesses have to make into their employees, the amount of work and money that it takes to start your own company, the health insurance tax makes literally no sense when you consider the harm that it caused to that population of folks who are trying to really deliver the best type of customer service and product that they can to their communities. So that's really the most dramatic group that faces the harm of the health insurance tax, and why Stop the HIT is so focused on the impact to the business community. But we also recognize that the health insurance tax directly increases the cost of coverage for seniors who are on a fixed income. So seniors who are enrolled in Medicare Advantage, who really have a very fixed monthly income, and where increased healthcare costs can have a dramatic impact in whether they are able to afford, their insurance or groceries or medicines. Again, taxing these individuals who are in a much more limited financial position ultimately undermines them trying to get the care that they need, makes it harder for them to afford their insurance, and increases the likelihood that they forego care altogether and let serious and complex conditions go and become much more severe. So the health insurance tax not only has an impact on those who are working, but also those who are retired and are on fixed incomes and really do need to be able to trust the health system and have access to it when they need it.
Wonderful. Claire, so we have about 5 minutes left in this segment, and as you mentioned before, we have been able to suspend the HIT for the last couple of years. Going forward, I would imagine that that's shown that we can clearly survive without this health insurance tax being imposed. And I would say that those suspensions are probably victories of battles, but winning the war would be eliminating the hit altogether, right?
Correct. We have been pushing for full repeal because full repeal would really provide stability and certainty to small businesses. So if you think about it, health insurance premiums are developed every single year, and so it takes into account any changes in healthcare costs, any changes to specific coverage requirements at the state or the national level. And so if small businesses and small business owners have a sense of what their healthcare costs will look like in the next year, they can adequately cover any additional financing or expenses that come through and just owning and operating a business. But when your healthcare costs and your insurance increase dramatically, and in this case, by $400 for each family each year, that's a significant chunk of money that ultimately reduces the amount that you have to invest in other meaningful causes or programs or benefits for your employees.
Awesome. So again, you're making this headway with the suspensions so far that you've seen. Can you use that in a case to show that it isn't necessary because you've been able to suspend it, you aren't getting those funds anyway, and life is still going on? Have you been able to make a case out of that?
Definitely. And I'll say that Senator Gardner has been instrumental in leading repeal and suspension efforts over the course of many years. He's been one of the biggest champions in Congress, and he recognizes more so than anyone that repealing this tax for good has dramatic and significant positive benefits for consumers and employees and also families. And so there's been bipartisan support in the Senate and in the House, and legislation that's been introduced on a bipartisan basis almost every year to make sure that consumers ultimately see the cost savings from HIT suspension.
Awesome. We have about 2 minutes left in this segment, Claire. Obviously, I would like to get more people involved, and you can learn more information at stopthehit.com. But that being said, what can I specifically do to get involved in this coalition and move it forward?
That's a great question. So if you visit our website on our About Us page, you can actually sign up to get updates from our coalition, but also ways that you can contact your members of Congress. So we would definitely encourage everyone in this next week to contact their specific representatives and urge them to suspend the tax to deliver that cost savings to Colorado families and consumers. But it's also a chance for you to share your own story. So we do have different opportunities for coalition members to engage with their members of Congress, to host either a roundtable event or a briefing session in their local communities, and also to share their stories. And all of those are great ways to get involved and make a difference for millions of families across the country.
Awesome. I really appreciate that, Claire. What is one last piece of advice that you would like us to know about this health insurance tax and why we should get on board?
So we have a critical point in time right now where Congress can take action to deliver the cost savings that Colorado families and the American public need. And it's important that Congress acts now. It's important that we get this done before the end of the year and before premiums are set for 2020 so that cost savings can be seen and really benefited from the people that need it. So as we look at how we can improve healthcare affordability and make coverage more affordable for the people that need it, repealing the HIT is step one.
Awesome. Thank you so much, Claire. It's been a pleasure having you on talking to us about this. Again, visit stopthehit.com. You'll get you can sign up for updates on where they are moving in the coalition and how to contact your local government so that you can have your voice heard. Be sure to like and subscribe our YouTube page while you're here. Find this podcast and more at cobrt.com/radio-podcast. Thank you so much, Claire. It's been a pleasure.
Thanks, Alex. I appreciate it.